Hello, my dear subscriber and viewers. Welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about remaining modifiers. In last video, I have explained some set of modifiers. So that was part 1 and this is part 2 modifier set. So those who are not watched the first part 1 video, please watch that video. I have pasted that link in the description box. So if you are new to my channel, please viewers subscribe my channel. In this channel I am going to post all medical coding codes for beginners and CPC. So if you are willing to write a CPC exam, then this channel will be very useful for those guys and beginners also. So then let's start from 51 modifier. So 51 modifier is multiple procedure, that means more than one procedure at the same session and same individual. Means more than one procedure, multiple, it may be 2 or it may be 3, 4. So if it is more than one procedures, means we need to append 51 modifier to the subsequent procedures, not to the primary procedures. So always this modifier should append subsequent procedures only. If it is only two procedures, then this modifier should append with the secondary procedure. If it is 3 or 4 modifiers, then 3, 2, 4 we can append, but primary procedure we should not append 51 modifier. Okay. Then if the multiple procedure means, you should not think like E&M services, rehabilitation, then supplies of vaccines. These services, it is not comes under multiple services. So multiple procedures means it should be any procedure, any surgeries. So those procedures only we need to append the 51 modifier. So then next modifier is 52 modifier is partially reduced services. So or partially eliminated services. For those cases we need to append 52 modifier. For an example, CPT description itself saying that procedure should be done bilaterally, but doctor performed only unilateral. For this meaning is partially reduced. So instead of doing bilateral, doctor has performed only unilateral. So this is the partially reduced service examples. For this scenarios, we need to append 52 modifier. The another example is colectomy procedures. For that procedure, anastomosis doctor should do. So if sometimes doctor may not do anastomosis, so those circumstances the service is partially reduced. So anastomosis not done. So those cases we need to append 52 modifier to the main procedure services. Okay. Then next modifier set is discontinued procedure. Discontinued procedure, there are 3 modifiers. One is 53 modifier, 73 and 74 modifier. So I am going to explain these 3 modifiers together. Then only you can able to understand. Okay, 53 modifier is discontinued procedure. So when we have to use this modifier means, if patient any patient conditions, if you continue the procedure, patient may get small bleeding or threaten to their life. So those scenarios, those situations, doctor may discontinue the procedures. So then if service itself very difficult or so we cannot continue the procedure. So doctor started and given anesthesia and procedure also started. So during the procedure, doctor discontinued means 53 modifier. So this modifier actually doctor has to do the procedure in the professional physician services. So this all the place of service also we need to look whether it is ambulatory surgery center or hospital outpatient or professional physician services. So 53 modifier we have to use in the professional physician services. So we should not use this modifier for ambulatory surgery and hospital outpatient services. The next point is actually if doctor pre-planned, we can stop this procedure up to this level. Like that, if it is electively cancellation of the procedure means we should not use 53 modifier. So planned cancellation we should not use this modifier. Then ambulatory services and hospital outpatient services we should not use 53 modifier. So 53 modifier means anesthesia started and procedure also anesthesia given and procedure also started. Then during the procedure doctor stopped that particular procedure means 53 modifier. Then next modifier is 73 modifier. 73 and 74 modifier is if a patient before starting the surgery, that means prior administration of anesthesia, the procedure stopped, discontinued means 73 modifier, and after administration of anesthesia procedure stopped means 74 modifier. So 73 modifier and 74 modifier we should use only for ambulatory services and hospital outpatient services. So then 74 modifier after administration, but sometime initial services they started, like incision they started or scopy they inserted. Then before starting the main procedure they stopped the procedure means 74 modifier. So there are discontinued modifiers. There are three are there: 53 modifier, 74 modifier, and 73 modifier. So 53 modifier procedure anesthesia given and procedure also started. Then they stopped the procedures in the professional physician services. Okay. Then if it is planned means we should not use. And 73, 74. 73 is prior administration to the anesthesia. 74 is after administration the anesthesia. Okay. Then the next modifier is, so maybe the reason will be like patient may get irregular heart rhythm or any issues related to the anesthesia or any equipment failure. So those reason maybe doctor has to mention, the valid reason doctor has to mention to append those modifiers. Okay. Then next modifier set is management care of. Management care means 54, 55, 56. So three modifiers I am going to explain together. So the first modifier is 54 modifier. 54 means surgery is performing one doctor and pre-operative, post-operative management done by another doctor. So that time 54 modifier. 55 modifier means surgery is performing one doctor and post-operative performing another provider. So that time 55 modifier. 56 modifier is surgery is performing one doctor and pre-operative another doctor. So if it is post-operative another doctor means 55. If pre-operative another doctor means 56. If pre and post another doctor means 54 modifier. So based on the post-operative or pre-operative which doctor is performing, based on that these three modifier we have to use. Okay. Then global period modifier. Global period modifier we have three set of codes modifiers: 58, 78, 79. 58 and 78 means those modifiers very similar. So for example, a doctor performed one procedure, any major procedure like cholecystectomy. So that procedure comes under 90 days global period. So during that 90 days, if patient is coming again another procedure, but that second procedure should be related to the main procedure. So that time if it is related means then we need to append 58 modifier and 78 modifier. Okay. If it is planned, staged or related procedure means 58. If it is unplanned or related procedure means 78. Okay. So 58, 78 both are related to the main procedures, but 58 is planned and 78 is unplanned. So 58 unplanned, when that scenario will come means if patient surgery done and they are in the global period means 90 days. So during that time any bleeding or any stent imposition, stent removed or anything related to main procedures, that time it is like complication. So if it is complication means 78, that time only patient will come unplannedly to the operative room for second procedure. So if it is complicated to the main procedure, to solve that complication, so that means it is related to solve that complication, that is related or staged procedures, that time 78 modifier. If it is planned procedures means 58 modifier. If it is unrelated to the main procedures, so during the 90 days first time cholecystectomy, that cholecystectomy period is 90 days. During that 90 days patient is coming any other heart related procedures or any other head related, brain or eye and skin related, so unrelated, it is both are unrelated, cholecystectomy and like heart procedure, so both procedures are unrelated. So that time 79 modifier we need to use. So these are the modifiers for global period. So during that global period, whether the main procedure is 90 days or 10 days global period, so based during that time patient is coming for the second procedures. So second procedures, whether it is related or unrelated. If it is related, whether it is complication or non-complications. If it is complication, then 78, it is non-complicated, that means planned means 58 modifier. Okay, then next modifier is 62 modifier, two surgeons. So when two surgeon performed as primary surgeon, like each surgery course we should append the 62 modifier, like main procedure heart CAPG or spinal or transplantation, like that very big procedure, like major procedures, one doctor cannot able to complete that procedure, so that time two doctor will involve and do together that procedure to complete that. So that time for two doctor we need to append same procedure code to the both doctor with 62 modifier. Okay, then next modifier is 63 modifier. 63 modifier is patient should be a infant. That infant patient's age less than 4 kg. So that patient, any procedure doctor is performing, then we need to append 63 modifier. So this modifier we should not append to the E&M services, radiology, anesthesia, pathology and medicine. So this modifier we should append only to the surgery codes. So one more time I am going to explain. 63 modifier is patient should be newborn, example 0 to 28 days patient, then that patient weight will be less than 4 kg. So that particular patient, if any procedure is doctor is doing, means 63 modifier. Okay, then next modifier is surgical team, 66 modifier. So 66 modifier, so surgical team itself they all together doing the procedure, means that time we need to append 66 modifier. 76 modifier means procedure is repeating by the same doctor. If it is procedure is repeated by another doctor, means 77. So same procedure again they are going to repeat by the same provider, means 76, by the other provider, means 77 modifier. Okay, so next modifier is 80 modifier, assistant surgeon. So with the main procedure, if any doctor is performing assistant surgery, means so 80 modifier. So assistant surgeon we have AS modifier also. So AS doctor should be PA. If it is doctor is MD, then 80, 81, 82 we need to append from this modifier, 8 series modifiers. But if it is doctor is PA, then we need to open AS modifier for that doctor. If it is doctor is MD, then assistant modifier 80, minimum assistant modifier 81. So assistant modifier when there is no qualified resident doctor or not available. So this document doctor has to mention we don't have a resident doctor to act as a assistant. So if we have this note, then we need to append 82 modifier to the assistant doctor. Okay, then 90 modifier. 90 modifier means outside laboratory services. So those service we need to append 90 modifier. Some set of modifiers actually there is no guidelines, there is no complications. By reading modifiers description itself, we can understand the uses of the modifiers. So like that only those modifiers only I am explaining very directly. So then next modifier is we have anesthesia modifiers and HIPICS modifiers also. So we'll start the anesthesia modifiers. What are the anesthesia modifiers? So let's see. So next modifier is anesthesia modifiers. So these modifier we have to append to the only anesthesia CPT codes. So the code range from 001002 to 01999. So this set of series only we need to append these anesthesia modifiers. So the first modifier is P1 modifier. P1 modifier means the patient will be healthy patient. So for that patient doctor is doing any surgery in giving anesthesia means this modifier we have to append. So healthy patient means when we can consider those healthy patient means so the patient is non-smoking or non-minimal alcohol use or they are not using alcohol itself. So there is no any systemic conditions. So those patients we have to consider it is healthy patients. So that patients we need to append P1 modifier. Then P2 modifier is patient with mild systemic disease. So the patient is mild systemic disease means for an examples, patient current smoker or social alcohol drinker, or patient is pregnant, or patient is obesity. So if patient is well controlled DM, hypertension, mild lung disease, those conditions patient is any anesthesia giving means, so those patient we have to consider it is mild systemic disease. So that patient we need to append P2 modifier. Then P3 modifier is patient with severe systemic disease. Those patient we need to append for P3 modifier. So severe means patient any moderate to severe diseases like DM, hypertension, poorly controlled DM or hypertension, COPD, morbid obesity, then actively hepatitis, alcohol dependent abuse. So then any patient placed any pacemaker or any reduction of rejection fraction, ESRD patient, so any ongoing dialysis patient, then premature infant patient, then past medical history patient may be having MI or CVA, like that stent patient has. So those patient considered as we need to consider moderate like severe systemic disease. For those patient we need to append P3 modifiers. Then P4 modifier is severe systemic disease that is constant threat to life. So patient also severe disease having, then it is threat to life means those patient we need to append P4 modifier. Then P5 modifier is morbid patient who is not expected to survive without the operation. So without operation patient cannot survive. For those patient we need to append P5 modifier. Then the last modifier from anesthesia section, P6 modifier. P6 modifier is the patient is brain death patient. So those who are giving organ donation or removal of organ, some purpose of donor, so those patient then we need to open P6 modifier. So these are the modifiers for anesthesia. So these modifiers we need to append only to the anesthesia code. So the code range from 001000 to 01999 series. Okay, the next modifier we will see the HIPX modifiers. So what are those modifiers? So HIPIC modifier is alphanumerical modifier like T2, T3, T4, T5 like that. If it is a more specific site, anatomical site like foot third digit or left foot fourth digit, left foot fifth digit, like that foot modifiers. Like that we have the left side and right side foot digit, then fingers modifiers we have, then eye related modifiers, like that HIPX modifier also available. So if any particular surgeries, any food related or fingers or eye related, so if doctor is doing means, then we need to specify the site of the modifier by using these HIPX modifiers. Okay guys, these are the modifiers we are going to use in the coding field. So now I hope you all understand part 2 modifiers. If you have any doubt in my explanation, so please comment in the comment box. I will reply you. So if any clarification in previous videos also, you can ask the clarifications. So I have pasted on the part 1 modifiers in the description box. So the new user, you can check in the description box. And for information to the new users, new viewers, actually this channels mainly for the beginners of medical coding and CPC, those who are going to write CPC. For those people, I am going to post all guidelines and overall the medical coding course in this channel. So those who are new to my channel, please make a note of this. Then in the next video we will see surgery coding guidelines, basic surgery guidelines. So we'll see that in the next video. And thank you for watching my video, and please subscribe my channel for more videos. Then only you can get notification for my future videos. Okay guys, thank you so much for watching my video. Thank you. Bye bye.